I thank Dr. Wally for his presentation to country and warmly welcome you all to this first session of IPDLN 2020. It's now my great pleasure to introduce Dr. Odette Pearson, our first keynote speaker. Dr. Pearson leads the population health platform at the Wardliparingga Aboriginal Health Equity theme of the South Australian Health and Medical Research Institute. The platform has a focus on understanding and bringing attention to the needs and priorities of groups that little is known about, including Aboriginal and Torres Strait Islander young people, men and older people, to inform policy and practice change. A main focus of her work in the South Australian is the South Australian Aboriginal Health Landscape Project. This uses administrative data that's been managed and curated in a culturally appropriate manner to measure and monitor health and social inequalities, and makes the data accessible to Aboriginal communities in South Australia. I invite Dr. Pearson to start her presentation.
Thank you, Maren. And I'd also like to thank Dr. Wally for his welcome to country. This is, a great opportunity once again to have Aboriginal health as a space in the International Population Data Linkage Network Conference. And later this morning on the panel, we'll be hearing firsthand from some of our First Nations leaders working in this space. Today, I'm going to talk a little bit about operationalising the principles of Indigenous data sovereignty in the South Australian Aboriginal Health Landscape Project. As always, I'd firstly like to start the presentation by acknowledging that I'm on the lands of the Kaurna people. The Kaurna people are the traditional custodians of the Adelaide region, and I would like to pay my respect to their elders past, present and future. I'd also like to recognise that the Kaurna people never ceded their sovereignty over this land, and acknowledge our First Nations colleagues around the globe who are here with us today. And also in the spirit of reconciliation, acknowledge our non-Aboriginal colleagues who work alongside us. So just to set the context for our international colleagues, it's important that we understand in Australia we have two Indigenous population groups, and there are hundreds of unique Aboriginal Torres Strait Islander language groups, clans or tribes, although collectively we are known as Aboriginal and Torres Strait Islander people. As of the 2016 population census conducted by the Australian Bureau of Statistics, there were 800,000 people who identified as Aboriginal or Torres Strait Islander, and the focus of the presentation today is South Australia, and within this jurisdiction there were about 34,000 people who identified as Aboriginal and Torres Strait Islander. So I'd just like to recognise the work that's been happening in Indigenous data sovereignty and in articulating principles of Indigenous data sovereignty and practice. This work has been happening by different networks across particularly Canada, New Zealand and the US, and more recently here in Australia. The First Nations peoples of Canada, New Zealand and the US have been talking for decades about the fact that data is a resource, and that as First Nations peoples, we have sovereign rights over our data. In Australia, as I said, this is a more recent conversation, and these conversations are being led by colleagues Professor Maggie Walters, Marcia Langton, Ray Lovett, who is also on our panel, have been very active leaders in this space, as well as Dr. Walker and Andrew Spool, who are in their respective countries active leaders and will be joining us on the panel. Also, just to reiterate that Dr. Walker gave the first inaugural keynote speech at the conference in 2018, and that this is available for those who want to hear more detail about the principles and the development of the principles and what's behind them. This is actually available on the website. Since the 2018 conference, the Global Indigenous Data Alliance network was established in Spain in 2019. And one of the main outcomes from the Global Indigenous Data Alliance is the development of the CARE principles. And the CARE principles are they aim to complement the FAIR principles, and many people on this presentation would be familiar with those principles. I work at the South Australian Health and Medical Research Institute, and at the Institute we have the Wardliparingga Aboriginal Health Equity theme. This institute was established about 8 years ago, and it is unique in that from its very inception it had Aboriginal health as one of its main themes, and a strong leader, Aboriginal leader in Professor Alex Brown. And the importance of these 2 points is that I feel we experience less institutional barriers found within the more established institutes and academies, and have been well supported to get on with our work. One of my main roles has been to establish and develop a project that we call the South Australian Aboriginal Health Landscape Project. And this project is a direct response to some Aboriginal community priorities that were identified in a forum that was held in 2013. And the purpose of this forum was to understand the priorities for research that would define Wardliparingga's program of research. At this forum, back then, people spoke strongly about the need to have access to the health and social data to use for their own purposes. And also, another key point that was strongly put forward was the need for this data to be representative of their local communities rather than aggregated at a state and national level. And it needs to be acknowledged that this was not the first time that Aboriginal people have been requesting access to their own data. So one of the first things I did was to set out to establish a governance structure for the project. And that governance structure included an Aboriginal governance group. And the role of that governance group was really to inform how the project would be brought to life. They were heavily guiding the contextual framework for the project. They were involved in the interpretation of the information, informed us how we needed to engage with communities and at what time points and for what reasons. The other important aspect to this was a technical panel, and we knew that we would be looking at data at small area levels, and so we needed to be sure that we could estimate sort of robust statistics, as well as understand the data sets themselves and where they were located. The other sort of key point of the technical panel was to create linkages between the Aboriginal governance group and the Aboriginal researchers, so that the technical panel could actually invest in building knowledge and capability of Aboriginal people within this space. So governance groups are one of the more common ways in which we've been working with our data. One of the other projects that I've been working on just recently is embedding an Aboriginal and Torres Strait Islander governance structure within the Registry of Senior Australians, which is located at SAHMRI. And this is really an important data set for us, the Aboriginal and Torres Strait Islander population, as it's the only data set of its kind currently, and it can answer really important questions that can inform service improvements for older Aboriginal and Torres Strait Islander people in aged care. However, up until now, the Aboriginal data has not been looked at, and the reason for this is that we haven't had Aboriginal governance within this data linkage project. Another area that I've been fortunate enough to be invited to work on is embedding Aboriginal and Torres Strait Islander and Maori governance within the Australia-New Zealand Renal Registry. This piece of work was led by Dr. Jackie Hughes, Denisha Duff and Satonia in New Zealand. And you can actually see a presentation on this website as to how and why the Aboriginal and Māori governance has been embedded into this registry. So one of the interesting things between the Aboriginal Health Landscape Project and the ROSA Advisory Committee is when we look at the terms of reference, they're about 6 years apart, and the ROSA terms of reference is much clearer in the way that it articulates the functions of the Aboriginal governance group, and it uses much stronger language, even though the intent of the functions of the governance groups are similar. I think one of the things that the principles of Indigenous data sovereignty and our work and our discussions in this space have allowed us to do is to articulate what we want to achieve in a much clearer and stronger way. So with the Aboriginal Governance Group and the South Australian Aboriginal Health Landscape Project, it was decided by the group that the first thing we needed to do was make data accessible to local communities, and that the data needed to support their local community governance. And whatever else they wanted to use the data for, it wasn't up to us to define that. It was really up to us to make data accessible in a way that was meaningful and relevant to their communities. And they also defined that it would be important that we could use this information to inform policy, service provision, and importantly, monitor the effects of these on our health and wellbeing over time. So the research group then set out to draft the geographical boundaries, and a set of design principles were developed. The main principle that was most important to the Aboriginal Advisory Group, and that we had heard at the first workshop and in subsequent discussions with Aboriginal community groups, was that the landscapes, what we're now calling the landscapes, were to be based on where Aboriginal people live. We also needed to be able to concord the data within data sets to a geographic unit. And so for that purpose, we used postcodes and SA2s to develop the landscapes. And we also needed a large enough number of Aboriginal people to estimate a reliable statistic. So we ended up with 19 landscapes, and most of them have more than 1,000 Aboriginal people residing within the landscape, and a few have just below 1,000 Aboriginal people. So the governance group then set about defining or developing a contextual framework to guide the analysis and the reporting. They adopted the definition of health from the National Aboriginal Health Strategy Working Party that was defined in 1989. And that's represented in the green. So it takes on the holistic holistic definition of health. In the purple, we have the population, and so they saw that there were different population groups with unique health needs, but then also the entire community. Community's health and wellbeing was important. The orange represents indicators of what was important to measure and understand, and the blue represents what the information is aiming to achieve. So one of the frustrations that came up when we were collecting the data according to trying to populate this contextual framework, and it's something that we continually experience, and I'm sure the panel will be talking about it today, is that there's limited information on particular areas of importance to us. And so it goes further than just, you know, what information is collected and by whom, but it actually goes to the very point of how we are defined, how our health and well-being is defined, and by whom. And this occurs even before data is collected. This is an example of some of the work that's being done and has been done and is, you know, currently being done by First Nations academics. This has been done by our colleagues Graham G and Pat Dudgeon, and it goes to defining social and emotional wellbeing from an Aboriginal and Torres Strait Islander perspective. Some of the work is currently coming into, we are now seeing data being collected that is more representative of things that are meaningful and important to us. For example, in the census questions, we've now got some of the cultural determinants, questions being asked around these. And that will continue over time. The other thing that was a frustration experienced by the Aboriginal governance group was the lack of or access to information on particular priority groups within the Aboriginal community, that including groups such as the stolen generation, prisoners and homeless people. So there were lots of discussion in the Aboriginal Advisory Group about how we would analyse the data and how the data was reported. So often it's typical to compare us with non-Aboriginal people, but this wasn't the purpose of the landscape project. This actually, what people wanted was to know about what was happening within their local community. And so that's where we ensured that just for that community population, we would report data belonging to them. The other thing was that the comparison between the Aboriginal state average was important in that they were then able to look at how they were tracking compared to Aboriginal people and communities across the state, and that they could identify, you know, communities that were doing well in certain areas and what those successes might be related to.
Nicole, we've got about just 1.5 minutes to go.
Okay, great, thank you. So the tension here in the reporting between non-Aboriginal people is that we're not comparing apples with apples. So the experiences that we have that directly impact on our health and well-being, particularly related or related to colonisation and its long-term and ongoing effects, are not experienced by non-Aboriginal people. And so this is often not seen as appropriate. And also the fact that non-Aboriginal people are seen as the gold standard of health and wellbeing, when in actual fact our ways of being and doing are different. We do have unique ways, and so again the comparison there it is not appropriate. It takes away essential parts of our identity. However, from a health equity perspective, it was also discussed that we can see that the system clearly works for non-Aboriginal people or different groups of people in the community, but it's not working adequately and addressing our needs. So there is an issue, an intrinsic issue there. I'm just going to skip down to the end of the presentation, given the time.
Yes, so we need to close in about 30 seconds.
Sure, okay. So at the end, we developed one report for each landscape, and one of the things that became a concern of the governance group was the way in which this information would be used. And so there were principles that were defined. These principles were borrowed from principles that were developed by the Aboriginal community to inform how we conduct our research.
Thanks, Nicole. We need to close now. So
thank you.